Ebola virus, also known as Ebola hemorrhagic fever, developed its name from the Ebola River located in the Democratic Republic of Congo, which is where the virus was first discovered in 1976. It is a life-threatening disease and has up to a 90% death rate. Extreme caution must be used when handling the Ebola virus or are in contact with people who are infected. Research facilities use biosafety level 4 precautions, which is when a highly virulent disease is kept in a cabinet laboratory where the microorganism is manipulated from spreading into the environment, and the disease may only be tested in a suit laboratory, which is where personnel must wear a positive pressure-supplied air protective suit to prevent the scientists from contracting the disease. It is part of the Filoviridae family and is a filamentous molecule. Ebola virus is an ssRNA virus and has a multifunctional VP35 protein. The VP35 protein blocks virus or double-stranded RNA, making immune evasion easier by interrupting antiviral signal pathways, and it also masks the replication of RNA, preventing the cell from recognizing an invading virus, which disallows the immune system to respond. It is still unknown what the exact cause of Ebola virus is, but researchers believe that the virus lives in an animal host in Africa. In Africa, the handling of infected chimpanzees, gorillas, monkeys, forest antelope, and porcupines found dead or ill have been documented for causing infection. It has been presumed that fruit bats are reservoirs or intermediate hosts of Ebola. However, the bats showed no symptoms but have a large geographical range, including regions of Africa where outbreaks occur, such as Uganda, Sudan, and the Congo. Researchers found bats of 3 species, H. monostrosis, E. frequenti, and M. torquata, to have either genetic material, also known as RNA sequence, or evidence of an immune response. Ebola can also be spread by direct contact with people who have the virus or infected person's blood or body fluids. Even once an infected person is dead, the virus can still be transmitted through contact, which is why it is important to call medical workers who will safely bury the body by placing the body in a body bag, spraying the bag in Lysol, then burying the body deep beneath the earth. There are 5 types of Ebola: Ebola Zaire, Ebola Sudan, Ebola Bundibugyo, Ebola Reston, and Ebola Ivory Coast. The first outbreak was in Zaire, when a 44-year-old teacher suffered from symptoms of what seemed like malaria. The hospital gave the victim an anti-malarial drug, but did not dispose of the needles nor sterilize them, spreading Ebola to many of the hospital patients. 318 people contracted the disease, and 280 of those people died in this one outbreak. Ebola Sudan also occurred in 1976, when a factory worker from Sudan became infected. Like Ebola Zaire, the victim and hospital did not know how dangerous the disease was and realized close contact was a method of transmission once 151 out of 284 people infected died. All of the different types of Ebola infect humans except Ebola Reston, which infects monkeys and pigs. This type was first discovered in 1989 at the United States Military Primate Research Facility in Reston, Virginia, while scientists were working with monkeys imported from the Philippines. A more recent case of an Ebola outbreak was in November of 2012 in Uganda. Uganda has had 4 outbreaks in the last 13 years, resulting in hundreds of deaths. A month before the November outbreak, Uganda declared itself Ebola-free, after a scare which was actually suspected to be an outbreak of cholera. The outbreak began when a 3-month-old girl died, and 15 of the 65 people who attended the funeral became infected, since in many ceremonies, mourners have direct contact with the body. 11 of those 15 people infected died. Due to this outbreak, Uganda's president, Yoweri Museveni, urged people to avoid unnecessary contact and discouraged handshaking. Ebola hemorrhagic fever has an incubation period of 2 to 21 days and is normally characterized by flu-like symptoms such as fever, weakness, headache, and sore throat. It is followed by vomiting, diarrhea, and internal and external bleeding from all orifices, which eventually will lead to death. Infections can only be diagnosed definitively in the laboratory by different tests such as enzyme-linked immunosorbent assay, also known as ELISA testing, antigen detection tests, serum neutralization test, and virus isolation by cell culture. Unfortunately, Ebola is a Category A bioweapon agent since it can be aerosolized, has a low infectious dose, a high fatality rate, and can be spread from person to person. Since there is no vaccine or other antiviral drug available to prevent Ebola virus, a bioterrorist attack using Ebola virus could cause a serious threat of widespread illness and death. Passive immunization has been employed, but its effectiveness is unknown, and as a treatment, there would be a limited supply of antiserum. Patients with Ebola will receive supportive therapy, which consists of balancing the patient's fluids and electrolytes, maintaining oxygen and blood pressure, and treating any complication infections. During Ebola hemorrhagic fever outbreaks in Africa, health messages are used to inform the public, mostly focusing on reducing contact between wildlife and humans by avoiding the consumption of raw meat and using gloves and other protective clothing while handling animals. Reducing contact between humans and close contact with the sick or patients is important, as well as washing hands regularly. Also, the disease should be properly and safely buried, and people should avoid pig farms infected through contact with fruit bats.